Almost 1,000 cases of COVID-19 reported yesterday. But will vaccinations put a stop to a fourth wave as 25 to 29-year-olds can register from today, which is the good news? Dr Mary Favier, COVID-19 advisor for the Irish College of GPs and a member of NPHET, joins us now. Mary, should we be concerned, do you think, that the numbers have got to 1,000 quicker than the HSE expected?
Yes, I think it is a cause for concern. We're up nearly 1,000 cases today, yesterday likely to be above that today and into next week. And the surge has started. We're 2 to 3, 4 weeks away from the peak of it probably. And so the real issue is, will vaccination hold and will we have enough vaccines done? So that's the challenge. What's different about this wave is that we have vaccination. It's really effective. But the concerns is we don't have our younger people vaccinated yet. And there are some people, for whatever reason, over the age of 50 who've chosen or not put themselves forward for vaccination. And they're of real concern as this surge rises.
Now, some people will be slightly alarmed, I suspect, when they see that, 1 in 20 of the cases turning positive have actually been fully vaccinated. Should people be worried about that? Or is it the case that, we always knew that fully vaccinated people, some would get COVID, but that they are fully protected from serious illness or hospitalisation?
So there are 5% of cases, indeed, 1 in 20 that are vaccinated who are testing positive. But we always know that while vaccinated is excellent and gives really good protection, it's not perfect. So now what it is showing is that there's much less serious illness, there's much less hospitalisation and death in the vaccinated group who become positive. But again, that's not complete either. And so we do need to maintain vigilance on all the other things, which are the standard precautions of mask and hand hygiene. And if you're not vaccinated, or indeed not fully vaccinated, do not go to places which put you at risk, which is really do not do things that are inside, do not take your mask off. We've got 2, 3, 4 weeks to really try and stay ahead of this. Keeping it, for general practitioners, what we're really concerned about is we're so busy with non-COVID things. The idea that a surge would come and would displace activity, that's the issue in our hospitals as well. Our hospitals are almost full as it is, trying to catch up on non-COVID work, very unusual for in the summer. But even patients are saying to us they're starting to look forward 4, 5, 6 weeks to schools going back, to colleges going back, anxious that won't happen. So we've got this opportunity to really make a difference. And it's our behaviours as well as vaccination that will make the difference. Well,
just on the issue of behaviours, I think people are rightly confused by the conflicting message coming from government and from NPHET about indoor dining, which will now hopefully open on Monday week. The Chief Medical Officer again coming out last night to say, don't bring unvaccinated kids into an indoor dining situation, whereas the Taoiseach only yesterday said leaving it to the judgment of households to assess the risk. Where do you stand on this, Mary?
I think the public health advice is clear. Do not put yourself in any situation where you increase risk. And that includes.
But how is a family to know that?
I think people should look to the public health advice and say, look, if people are not vaccinated, if there's anything going on inside that puts you at increased risk, really think twice about it. Because the concern now is that, and this is entirely understandable, everybody's tired, everybody's effectively sick of it. However, we've just got a final push before we can get full vaccination, and until that's done, absolute vigilance, because people do not know, are they going to be one of the 5% who's vaccinated who continues to get it? And the real concern is that if we have a really big surge, that it'll eventually come into people's homes and catch the people who are not vaccinated for whatever reason or can't be. And about 10-15% of people 50 to 60 are still not vaccinated for whatever reason, and they need to be really vigilant.
But I mean, it is the case, Mary, though, that children are far less likely to get COVID-19, and even if they do, they're far less likely to pass it on or get seriously ill. So what is the risk of going into a restaurant with your kids, particularly if there's social distancing and people are in their bubbles?
Indeed, you're right. Children, particularly under the age of 13, much less likely to get COVID, much less likely to be sick with COVID, but doesn't mean that they're not going to get sick with COVID. And there is indeed some long COVID in children. But it's about bringing the virus into environments that really increases the spread of it. And we've seen COVID cases in the last number of weeks that were in outdoor dining, outdoor pubs. All the appropriate public health regulations followed, but when people went inside, into the toilets, up the stairs, and then that's when COVID spread. And so they're the types of environments people need to be really careful of. Gel your hands before you go in, wear your mask, gel your hands when you come out, be careful, don't touch your face. All that type of advice, it's to drill it back into our brains. We've got to keep this off and just be cautious. It's the summer. The Irish people, we love the summer. We've just got to say, this one has to be a cautious one and try and do as much as you can outside.